What's up, y'all? Thank you for checking out the channel. This is Not a Real Doc DPT, and no, I'm not a real doctor, but I am a licensed and practicing doctor of physical therapy. And today we're going to be talking about a topic that people often get or have a lot of questions about, and that relates to the different types of therapies that a patient may receive. So there's physical therapy as being one of the primary ones. Occupational therapy is another primary therapy that a person may receive, as well as speech therapy. So not everybody understands the differences between those different fields, and so that's what we're going to touch base with on today. So occupational therapy, that's probably the most confusing one because of the name of it. Everyone thinks that, well, occupational therapy, that has to do with my job. And oftentimes you'll have patients say, well, no, I don't want occupational therapy. I'm not working. Um, that's not exactly what it is. Occupational therapy is more working with how you function, and working to improve how you function within whatever environment that you spend your time. So yes, they may work with patients who are, returning to work and have had pain or something like that. That's, they've had some injury or something else, like a workers' comp patient. They may be working with also bedbound patients who don't have a job. um, as a physical therapist, I would say that the main differences that I see with occupational therapy is occupational therapy, or let me come back. The way that I've experienced them and the practices that I've been in when you have both PT and OT working together, how we tend to use those is um, occupational therapy. It is known to be it's a gentler form of therapy. It's mainly going to involve upper body. They are generally considered to be specialists of the hand. Um, they're going to work with difficulty patients that are having difficulty dressing, if you're having difficulty toileting, if you're having difficulty showering, those types of skills. They oftentimes will bring in tools with you to help you to do those different types of things. Like there are reachers that they'll bring in so that you can use to lift things that might fall on the floor. There are dressing tools, there are sock aids and things like that. Occupational therapy is really known for bringing in a lot of tools to help assist the patient with whatever environment they're working in to improve their function within that environment. They do work for pain. For pain issues. They do work on issues with dysfunction. As I say, they generally are an upper body. Oftentimes, OTs are going to work in the neck and shoulder issues. They can work on back issues. Sometimes they'll work on that. We generally have considered when OT and PT are in the same practice, you'll say, okay, well, OTs, they're going to work from the waist up, and PTs, we're going to work from the waist down. So that's in general kind of how that works. Now, I may be completely butchering that. I have a buddy of mine that is an OT, and I'm sure if whenever he sees this video, he's probably going to call me and rag on me for my definition and how I've explained it here. But in my mind, that's how I kind of see occupational therapy. It's it's an easier form of exercise or of therapy. Oftentimes, patients that are uh, that have more severe dysfunctions, they tend to do a little better with OT to start, and then as say that bedbound patient, maybe an OT, maybe you'd start with OT for that patient because, as I say, it's easier to work with them, work in their upper body and things, and then that OT may progress them to sitting at the edge of the bed. OTs can work on transfers, transferring from the bed to maybe a bedside commode or a bed to a wheelchair. Then, once that has happened, oftentimes then in the practices where I've been, the OT then would pull out and stop seeing that patient and then bring in physical therapy And then we would then continue to progress that patient from continuing to work on those transfers, and then starting to have them stand, starting to work on having them move, and that kind of a thing. So that gives you an idea of what occupational therapy is. Um, so, well, I'll go ahead, and since I introduced physical therapy there, I'll go back into, or I'll go ahead and talk about that. So, physical therapy, we're trained head to toe, so we can work and do work often. The neck, we work shoulders. We can also work the hand, although the hand, there's so much going on within the nerves and the different glides that have to happen within the fingers, that oftentimes even PTs will refer that to an occupational therapy, because those OTs have really created hand special, or created a specialty for themselves in working with the hand. Um, that said, I have worked with plenty of hands as well. As a matter of fact, I really enjoy working with hands. They can be fun because you can see a lot of progress with a patient. But as I say, physical therapy, we're trained head to toe. We are going to be working on transfers. We're going to be working on helping a patient to walk. We're going to be working on their balance. We're working on pain and dysfunction for any joint, any pain that you're having from head to toe. That's what we were trained for. That's what we work on. We are also working in the work environment. We will do a lot of workers' comp patients. We'll do post-surgical patients. We'll do trauma patients, like motor vehicle accidents, things like that. We may do a little bit of in the direction of cardiac rehab, although it's not actually cardiac rehab. It's not the same as when you're working with an exercise physiologist, because we're not doing lines and looking at your heart and checking your blood pressure and all that as you actually are exercising. That's cardiac rehab. But we may do 2-minute walk tests. We may do 6-minute walk tests. We may be looking at checking your blood pressure and your heart rates and all that before and after exercise. So we kind of go into that direction. We also do we work obviously very significantly with athletes, and helping them to return to play on the field, and we work, just as I say, with pain and dysfunction. We're physical therapists, I would say, are considered more the movement people. So if you are having difficulty with movement, if you're having pain with movement, that may be as small as individual joints, or that may be your entire shoulder or arm, or that may be your entire body. Just as as I start to stand up, I just ache all over, and I'm having difficulty moving, and I'm at a high risk of falls because of that. So all of that we would say would fall under a physical therapist domain. That all said, well, let's go into the speech therapy realm. So, as I said, we're trained head to toe. The one area I would say that we're not trained a whole bunch on. Now, there may be some PTs out there in a specialized ENT practice that maybe get into this, but I really don't see why you would, because this is what speech therapists do. So, speech therapy, those folks are speech and language pathologists, and what they will do within speech therapy is, well, obviously working on patients, how someone speaks. If a person has had a stroke, if they've had developmental issues in the brain, and so they're not communicating well, that is one area that a speech therapist will work. If they're having difficulty with the way that they, like a child maybe has difficulty in the way that they pronounce certain letters, things like that. That's a very much within the realm of speech therapy to treat those types of patients. So anything related to difficulty with speech is a speech therapy patient. It's something that, because that's also falling along the lines of those muscles that are involved with speech. If you're having difficulty with swallowing, that is also something that is a speech therapy area. So, any patients that maybe having difficulty chewing, difficulty getting things down, they're needing maybe thickened foods or, choking with water, anything like that. That's going to be in the speech therapist domain. Even though I said we're trained head to toe, we understand what's happening with a lot of that, but I, as a physical therapist, wouldn't feel comfortable ever treating someone for those types of conditions. Um, so that's all in the speech therapy realm. Also, one thing that speech therapists do that not everyone recognizes or understands that they do is they work with memory issues. So we've used our speech therapist quite a bit with patients maybe who are in an early onset type of Alzheimer's, um, Parkinson's patients that with a maybe that it's progressed a little bit. Those types of patients can benefit from speech therapy. So anytime you're having anyone that is having memory issues, those early dementia types of patients. Okay, I think we're back. This darn camera, sometimes it just will shut off for no known reason. Anyway, so as I was saying, speech therapists that are maybe working with those patients that have dementia and are having memory types of issues, that is another area where a patient may benefit from speech therapy. So, um, those are really the three main areas of therapy that you may encounter in like a home health setting. Occasionally, you will in an outpatient setting. You would in a skilled nursing facility setting. Um, Usually, OT and PT would be in an acute care setting. Not speech therapy is not always in that area, but I believe there may be, you may typically find at least one or two that are kind of in the practice. That's probably going to depend on the hospital system that you're talking with. But those are the main types of therapies that you might encounter, and those are the differences between them. So if you have any questions about that, I'd be happy to entertain those within the comment section. So please leave a comment, and I will help answer any of that that I can. If this has been something that has been beneficial to you, I ask that you hit that thumbs up button. And if this type of content is something that you want to regularly look to receive, then give this channel a subscribe. All right, y'all have a good one. Bye.